Welcome back, everyone, to Dear Body, I'm Listening. Today's guest is someone who truly gets the body on every level. Peter Stuart is a registered massage therapist who spent over 30 years helping people move beyond chronic pain through gentle, trauma-informed myofascial release. What makes Peter's work so special is his shift from those old deep tissue, no pain, no gain techniques to a lighter, science-backed approach that honors how trauma and tension actually live in the fascia. He's logged more than 30,000 hours in his practice. He's taught healthcare professionals and brings a beautiful mix of anatomy, evidence, and empathy to every session. If you ever felt like your body was holding on to pain or emotion that no one else could see, this conversation is going to feel like an exhale. So I'm happy to welcome Peter. Welcome. And I just always like to ask the first question, so you can tell me anything that I missed in your introduction, but what got you into body work, and why are you still so passionate about it?
Yeah. I started off I guess I've had a lot of my own injuries and illnesses since I was a child. It was funny. I do a mentorship program for therapists, and one of my patients we were working on the other day had asked me about, what's my background on, injury. And yeah, the list kept going on and on and on and on. And, by the time I was 18, I had accumulated a lot of significant injuries and concussions and things like that. But I think the catalyst was when my knees got bad enough that I was playing a sport at a national level. And then I, once my knees started to go and no one could figure it out, I was in pain most of the times. If I participated in sport, I would be in pain, and my brain was just so focused on, that's kind of who I am, so there's a real identity shift. And not very talked about is when you lose who you think you are to pain, the amount of depression that sets in later on. And I didn't even see it. I just tried to shift. I was starting a new family, recently married, and thinking, yeah, this is all just life. It's all good. And then it just hit me one day like a ton of bricks, how depressed I was. So what I ended up doing is, when I was in Calgary at this point, I had my own clinic, but I started working for a chronic pain research and treatment facility called Myosymmetries under the guise of Dr. Stuart Donaldson, brilliant man, a great mentor to me. And his approach to the body was whole. And that, yeah, so the sum of what was happening to me was the accumulation of years of trauma, and even the mental and emotional aspect of that, the healthcare, that I didn't grow up knowing I was ADHD. I really only found out a few years ago through a psychologist friend of mine, and that made a lot of sense. My kids, I had this memory sort of box that my dad had put together, and my kids had asked if they could go through my old uh, the school records and look at my old marks and things like that. I'm like, oh yeah, that's fine. Just the comment from the time I was in kindergarten to right up until I ended high school was, Peter has trouble focusing. Peter doesn't pay attention. Peter needs to try harder. But Peter, when he comes to think about it, would had a lot of anxiety and depression around the way his brain worked. Because if I got assigned a novel in English class, like in grade 10, and I didn't, and it didn't really click with me, I'd have to read each page 3 times. It was a daunting task. And then I'd have the shame and guilt thrown at me of, you don't work hard enough. You're not achieving the same marks as other kids. I shelved it all. I just stuck it away. I just tried harder, and I tried the best I could. And you know, my dad, God love him, he was concluding the fact that, hey, you just don't have that same kind of brain that some of the other kids do. Don't take it to heart. And I'm like, well, you know, I'll try harder, and which isn't even a thing. I needed to
Mhm.
focus on what I was good at. And it turns out what I became very good at is helping others who are in pain. Um, so when people come and see me, I can really identify with the various aspects, mental, emotional, and physical, of what they're experiencing. So how did I get into this gig? Well, I went to see a friend of mine who was studying massage therapy, and she was going to work on me as a project while she was home for a couple weeks from school. And she's going to work on my knees. And I got talking with her, and I remembered how much I loved the body in high school. I loved reading about it. I was in a traditional high school, math,
Mhm.
geography,
Mhm.
you know,
Yeah.
and didn't get I did biology and physics and chemistry, but the body stuff was really fascinating. So I connected to that. So I became a massage therapist, a 2-year program in Ontario, at the Canadian College of Massage and Hydrotherapy. But after that, working at this chronic pain clinic and seeing these people, the way they were being reached wasn't through traditional therapy. That the nervous system wasn't really responding for people who had chronic situations with, with, well, let's just put it this way, that the nervous system had very little response to, um, you know, traditional means, in that we couldn't manipulate the nervous system in and by the techniques we were using to make any permanent change. There's always a shift or a change in the short term, but not in the long term. So it was the gentle style of myofascial release, which was having a tremendous effect. Um, so how are you able to shift the nervous system with that? I was fascinated. Now, I'm not doing it at this point, but I'm in my clinic, and my own private clinic, and who starts showing up to me, but chronic pain people. And I'm like, okay. And I had this one, Donna, I'll have to, just remembering this now. She was the breaking point for me, the catalyst that made me shift. And she was a woman who had been, mid 30s at this point, and she had seen a lot of therapists already, post her motor vehicle by about 4 years, and hadn't gotten better. Heard about me, came to see me, and I wasn't making too much of a change either. And there's a bit of an ego involved when you get into this, right? Like, you want to see successes. Um,
Yeah.
and so I just said to myself, you know what? You're going to give her the best massage anyone's ever had. You're just going to go all out. This is going to be the best, right? You're going to include
Uh-huh.
everything. It's just going to be amazing. I'm building myself up, right? And she gets off the table after an hour, and I say, "So, how do you feel?" Immediately fishing. She gets up and she's like, "Oh, actually, I feel really good. Wow, I can move better. I haven't felt this good in a long time. This is great." And then she leaves, and I'm like, "Yes, finally, breakthrough." Had it in me all the time. Of course, she comes back 2 days later. There's a little black rain cloud overhead, and I'm like, "Oh, huh, okay." And she's not talking about how great my massage was and what an effect it had on her life or anything like that. So I'm like, okay. So can you tell me a little bit more about how you felt after the treatment was done? And she was like, oh, yeah, yeah. Let's see here. I went home, and oh yeah, I felt really good actually. Actually, I felt really good. And my brain's going, that's better. Yeah, tell me about that. Feed me. And then she goes, up until about supper time. And then it all went downhill from there. And I was just like defeated. I was like, well, I can't keep going on like this. I want to help these people. And so that's when I made a change. Also, I was getting a psychological aversion to having oil on my hands on a regular basis too. I had a towel on me all the time. I was constantly wiping my hands, going, I can't keep this up either. Um, so I went down to the United States, and I did a lot of courses in gentle style myofascial release, and the same style that was being used up at our clinic and the chronic pain clinic, and immediate shift. And it was about, combining the philosophy of the general style of myofascial release with the philosophy of Dr. Stu Donaldson, treating the body as a whole person, and then seeing well beyond what is in front of you, makes a significant change in people's lives. So that's basically how I got into it. A long roundabout story, but
No, it's beautiful. Because
yeah.
I am that patient that like tries everything and like, okay, I totally, yeah, everyone else gets immediate results and they feel great and it lasts. And I'm your client that came in would be like, oh, I felt great right after it. It didn't stick. So I totally relate to that. And also that you didn't take that as like a one-off, like this lady is just, she's not my client, she's not for me, but I really want to understand how in someone with chronic pain or having this, that they respond much differently and searching that out because that's a huge provider, whether you're a massage therapist, doctor, which a lot of my audience and a lot of what I do is, I'm 54, so I did not diagnosed with any of my things that I've had since my was like genetic. Some of them are genetic: hypermobility, EDS,
Mm,
lipedema, uh, MCAS, POTS, and lipedema. So I have a lot of those things that my fascia has like been freaking out about. And I was
mm,
trained as a psychotherapist that focused basically just all on trauma, and that PTSD was my thing. So there was like, I thought I was doing all of these techniques and all of these things to process my trauma. And really, my fascia got all jacked up because my body is learning to survive but creating new pathways. So I think it's really fascinating that you spoke about your history with like how you felt your brain was different, also how much your ego, like just as like you were a sports person, like whatever sport you were
mm,
in was a part of your identity, and how
mhm,
chronic pain slowly does it. It's not like, oh my God, I have this pain, I'm so depressed. It's very insidious and it changes. You don't think that it changes your perception, but it
mhm,
does, because I know it's changed mine. And I was like in the mental health, I was a runner, a Pilates instructor. I did all these things that were healthy, I thought, and I was still, my body wasn't, uh, there was a disconnect. I didn't know about all these things, but that was going on with me to help. But there isn't that, there is this like kind of gray area that you really illuminate that is, you work with the fascia, but it also brings out the whole person in that. And all of these things is about the whole person. It's not just like, I have pain here, how can you do it? Treat me. That pain there, depending on how long it's been, might affect like your career or what you do. And there's emotions that go along with that. So it's a very beautiful work that you've done. And I'm fascinated even to hear more. So can you describe like what myofascial release is, how it's a little bit different or maybe different than like getting a massage, and then the process of like how you assess someone that comes into your office, and is there different like protocols depending on, like, say I come in with a whole lot of stuff, like I would be one of those clients who's like, oh gosh, she has a lot of stuff going on and it
mhm.
may take a minute to get her to respond positively to anything. But do you have like different protocols based on what your diagnosis is, or do you just really look at the body and find out what the body needs? I know I asked you three questions there, but so just talk about whatever you want
Well,
to.
I'll start with the fact that, myofascial release, it's sort of an umbrella term, really. I mean, myo is Latin for muscle and fascia is Latin for band. And it's basically, people think of it as the band around the muscles, but it interdigitates every structure we have. In fact, it creates structure in the body. It's a liquid system down at its core. And and it can have tremendous effect on how people are operating, right? It's basically the immediate environment of every cell of your body. So it has a profound effect. The research going on today is just incredible. And I think we're going to prove And these are all medical researchers, right? Doing, or most of them are physiatrists and medical doctors. It just, I think we're going to prove that fascia has an influence on just about every element of our well-being. And so it's a good question. I mean, how does the gentle style differ from more aggressive styles? There's a lot of aggressive styles, but I've never find, and that was the thing that we found at Myosymmetries in our chronic pain treatment facility, is that aggressive styles tended to flare the nervous system. And the last thing you want to do is flare the nervous system of somebody who has chronic issues, because it'll take less stimuli for them to flare again. At least that's what our findings were. So we eliminated a lot of different types of therapy because they were too aggressive. The light touch fascial work was the type of work that sort of just gently applied to the body, no oils, thankfully, and right. So
Yay.
right.
Well, yeah, especially if you have MCAS and stuff like me, like sometimes oil or smells or
Oh,
lotions,
right.
they don't. So, and I can't imagine like being a provider. You have to deal with it all the time. So, sorry to interrupt.
Well, we couldn't have scented. I mean, back then we knew at the chronic pain clinic that scents were bothering people, but it would take probably another 10 years before that was universally accepted. But so this is just a gentle hands-on placing of the body, or placing the hands on the body, and just you gently sink in, and then you when you don't feel like you're going to sink any further, you push away until you feel a barrier of tension, could be immediate, and you wait, and you allow this piezoelectric effect to take over, which um, has long been held the theory of how fascial work is effective in making change in the nervous system, and beautifully described and proven by two Nobel Prize winners for science on finding new receptor sites on nerve cells, the piezo 1 and piezo 2, and the TRVP1. I'm not going to get into all that, but needless to say, it kind of it supports the idea that a low level pressure will create a change in the nervous system over time. So it's patience. And then when I feel the release, basically that release is known as a creep, because you just feel a movement under your hand and you start to follow it. And when you follow that movement, you're not trying to make that movement go the direction you think it needs to go in. This is all about allowing the body to move in the direction it wants to release. You know, the body's intelligent. We just have to show up. I equate it to a dance where the body leads and I follow. Now, my wife might take some different approach to that. I don't think she thinks I lead very well. So,
But in this, you do.
but in this, I think dancing with my wife, I've learned to follow. She's much better than I am. And to be honest with you, it takes a lot of the guesswork out as to, you know, what is needed to open up an area of the body. So in a nutshell, that's the difference between the myofascial that I do and somewhere where you get into more aggressive knuckles or elbows and things like that to try to create change. Now, you may use an aggressive technique for a matter of, 20 to 30 seconds in an area if it's really stuck, but I don't even really do that anymore. I just hang out with the body and wait for it to open up and just listen for what it wants me to do. So it is a very different style, but it makes a change in the nervous system. And the great thing about this is we have incremental change with every treatment. There's no leap or bound toward, oh my gosh, they're 100% now, or 80% or 50% of, better in a treatment. If somebody has a strange leap like that, I always tell them it's not going to hold, right? Your brain can only hold so much information, and that would be a tremendous amount. So what I do tell them is that incremental change over time creates permanency in the brain, to make those changes happen, and establishing new neural pathways from repetition of, say, for instance, one of the big courses that I do is that I created was this pelvic rebalancing. I'm sure there's other therapists out there who do a version of it, but um, and what I found is, the pelvis is the foundation of the body. So if you're off in your pelvis, everything above and everything below is going to be off. And you could have had this chronic pelvic imbalance for a long time and not known it, but essentially makes one leg shorter than the other. So if you are out running or doing activities, you're increasing your imbalance over time. A lot of people believe that they're helping themselves, and when in fact they may just be creating more dense patterns of fascial tissue tension. And you combine that then with a slip and fall, or a motor vehicle accident, your workplace posture, the mental and emotional stresses that you've been through. So that leads me to say, when people come in to see me, I do an hour and a half intake, and I ask a lot of questions because I'm treating the whole person. You may come in with a shoulder injury, and and you're coming to me because you've already seen a number of good therapists, and you've plateaued in your therapy, or you're not getting the resolve that you want from the injury. Hopefully you've had pictures taken, and you've had the exams, physical exams done to see whether you have, tears or anything like that happening, that may need a surgical intervention. But if you're coming to me and you have a long-standing shoulder situation, and you've seen other good therapists, then I have to ask the question, why? Why are you not healing? Because if the body's a self-correcting mechanism, what are we missing? So I ask a lot of questions, and a lot of it is based on trauma. I'll ask, if people understand any of their past trauma, being from in utero to birth trauma to their childhood traumas. It's accumulative, and that's what we found, all creating tensions and patterns in the body. Then you have your mental and emotional trauma, um, the time, maybe your parents got divorced, or maybe your dog died, or your horse died, or whatever it is that you're into. Something's affected you because you can't get out of this life without it. Or maybe there's more involvement. Maybe there's childhood abuse, or you're dealing with an alcoholic in the family, or a narcissistic parent, or, things like this, in which case, even the narcissism, it's interesting. I have a patient who had both her parents were narcissists. And I asked her to describe how she grew up. And she just put her hands over her head like this and just said, I was bombarded with negativity. So she turned to sport to try to be the catalyst to get out. But then she was playing soccer at a pretty high level, and ACL, MCL injury, and never could play at the same level again. Didn't realize how depressed that made her, because she lost her identity that helped her get out of underneath the shadow of her parents' narcissism, which she hadn't really faced. So she became a very hypersensitive person to touch, as well as, starting to accumulate more and more issues in her body. So, yeah, it's those kinds of things that I want to find out from people. Like, I don't have to know all the details, but I do need to know what you've been through, because most people have been through stuff, right? It's not uncommon. And I've been trained as trauma informed, and so I can understand this stuff. It's no reaction to it. It's a matter of, okay, so if we list up all the things that have happened to you, it's quite amazing, right? And then there will be some people who say, well, I've had nothing wrong with me. I rolled my ankle once. That's all I can remember. And I'm like, Hang on to that. We'll come back to that. You'll probably remember some stuff as we go along, or the body remembers, because sometimes when I got my hands on a body, people will react emotionally. So the emotional trauma is sometimes just right underneath. Sometimes you just start to see people's throats go red when you're working on an area. There's so much held here about what wasn't said, or to shut you down. When you wanted to scream, it wasn't safe. Things like that. And when that comes up, it's a great intervention for me to be able to then refer to colleagues of mine who can help them through those situations if they haven't done talk therapy or EMDR or whatever. There's a lot of really good therapies out there. Psychotherapy. I love psychotherapy because it's really cutting to the chase, right? I love that
Yeah.
style, right? And so and in the interview, it also gives me the opportunity to refer out when I hear their stories. Are they nutritionally well? Do they need help there? Psychologically well? Are they coping with the stressors of their daily job? Like 9 to 5, 5 days a week, you hate going to work. That is probably one of the biggest catalysts to keep you from healing. And it's about taking a team approach to help people, you know, reclaim and reclaim the parts of them that are stuck, and how they feel that it's okay to put themselves into situations where they're, you know, compromised on a regular basis.
I
You know.
love your this whole approach because you really are the thread between, like, literally with the fascia that goes throughout the body, but in between the psychological, the nutrition, all the aspects of life. And that when they come to you, it sounds like it's not just to kind of have this pain go away, but really to listen, which I know in my world, there's a lot of medical trauma with doctors just not listening, just kind
Mm.
of writing it off as, oh, maybe eat less, move more. Oh, it's probably that phase of your life. Like, don't worry about the pain. Like, so
Oh,
there's so much of that in the US, and as far as the women that have been underdiagnosed or undiagnosed forever. But it sounds like when they come to you, it's not just do my shoulder, but you really take the time to listen, which is key to kind of make sometimes people just want to tell their story. Maybe not the person with the ankle, but eventually those people with the ankle probably really want to tell it. They just have like pushed it down, right?
yeah. Oh, oh,
So it's
very
like,
much so.
so it's
Very much so.
too much to even go there. They're like, no. But that's nice that you also have the trauma informed background or part of it, that when they do have an emotion or something comes up, that it sounds like you're able just to be a nice neutral place to have that stuff land as you move through the fascia to kind of start the healing. Because it sounds like, and I do want you to talk a little bit more about the science with the cells and the fascia, because I am fascinated with it, that it does hold trauma memory, it connects things, it helps, like you were talking about neural pathways. I think the body is amazing. Like, the fact that everything I now understand that my body's go through, that I'm still breathing and alive, and how it's created all these different pathologies to keep me alive based on everything I've inundated to it, and how it's not really functioning optimal. Like, when you find that, when you unravel that with you actually hands on, the
Mm.
fascia really does speak to the kind of to have a safe, because I'm assuming, and you could talk to this as well, but when I've done trauma
Mhm.
work, and kind of my view is like, until your body feels safe enough to even process any of the things that it's like got, cumulative trauma or anything, your body needs to be safe and relaxed. So it really is the opposite of the push harder, do more, force it down. You really have to kind of go the opposite, get quiet, find people that you feel safe with, even breathing within yourself, and then you can start to unwind it. So with the fascia and the cells that you talked about, is that what is it connecting to? Is it connecting to the fight flight response? Is it neurotransmitters like cortisol? Or if you can be a little sciencey as much as you want to, and if you can make the sciencey part understandable, that would be great too. But if you can't, that's fine. But I'm just really curious about what is it about the fascia that holds on to it and it protects us? Like, what's that mechanism that I see it as a protective thing, but I could be totally wrong.
Well, you're probably familiar with the work of Peter Levine, and his colleagues. I mean, back 30 years ago, when I was, first starting to understand and read Peter Levine's work, he had equated that our hindbrain or nervous system would tend to imprint not just physical but emotional and mental traumas, um, and you know, and then that's where we first heard the term PTSD, back in the late 60s, early 70s, when he was working on Vietnam vets coming home. And since then, that phenomenon has expanded, and he's got so many amazing colleagues who do a lot of great workshops on this sort of thing. And I don't take necessarily a somatic approach. I stick mainly with the fascia and allow the body to release at a time when it's ready to release what it wants to release. And I never know what area is going to come up with something. And I don't expect it in everybody. And not everybody emotionally releases. Um, and one of the things that we had, like, if I was physically injured by, somebody unfortunately took a fist or a bat and hit me in the shoulder, I would have physical damage there, right? And we would understand why that is traumatic there. But where the body, how the nervous system lays down the trauma in other areas of the body that are mental, emotional, I can't really speak to that because um, it's kind of a mystery still. Um, Now, there are schools of thought that say that the body doesn't hold this, but it's you touch an area and it tweaks something in the brain to remember. To me, it doesn't really matter. After 30,000 hours of
People.
clinical experience of doing this, you can think what you
Okay.
want, but I can tell you exactly that. I could even give you a story. I had a school teacher a school bus driver, one time come to the chronic pain clinic, and she was in her mid 50s, icy conditions. She only had a few kids on the bus, maybe about 6 or 8 or something like that, and she slid off into a ditch. Not too many injuries. One child unfortunately broke her arm, but for the most part, they got out of it unscathed, except for the driver. So she had constant chronic low back pain. And I had been doing, we put her through the assessment tests that we normally do, and she was very positively responding to the myofascial release in her body and changing shape, but she wasn't changing pain. And then it was interesting because at a certain point, I was like, I don't know if there's anything more I can do for you because your body looks incredible. It is aligned, like, and your tissue is in good shape. And why do you still have chronic pain? And I remember one of my teachers came to me in my head and just said, if you ignore people's scars, then you're doing them a great disservice. And
Mm.
immediately I went back to her chart and I was looking at it, and then I'm like, oh yeah, your appendix scar. Let's take a look at that today. Now, unfortunately, she's in tears because she's just at the end of her rope. She's suicidal at this point,
Mm.
um, um, or starting to talk about it. Um, and I laid her down on the table and was examining her scar. And of course, it's quite small and it's old, you know. She got that when she was like 10. So, she's 55, is 45-year-old scar. And when I started to do work on it, I asked her permission if that was fine to proceed. Um, we started doing work, and she's like, "Yeah, no, that's fine." And I was doing this release on it, and all of a sudden the tears came, and they came, and they came. And then I was helping her work through that, breathe through it, and allowing her space to, and she knew it was safe. She already trusted me. And then I said, if anything comes up, just let me know. And then she just said, this is all about my husband. And she was divorced. But she was narcoleptic, and her husband used to assault her at night, sexually assault her while she slept. And she didn't find out about it for years. When she figured it out, she divorced him, and she had the authorities arrest him, and he actually went to jail.
Mhm.
Um, and this all came out in this tiny little scar. And we had a 1 hour session, allowing for her process to grieve and allow this to come up. And I talked to her about, I said, have you done any talk therapy around this? She said, oh yeah, I have. And I don't feel like this is like, I don't feel right now, once as we've finished, that I have anything more to say. I'm just really glad this came up. So that was a Friday, and I said, okay, so I'm going to see you again on Monday, and of course, just call if there's any issues coming up over the weekend if you need support. So she didn't call, and she walked down the hallway Monday just strutting with her cowboy boots on, which she hadn't worn in years. And I said, well, look at you. You look completely different. She goes, I am. And she said, I got my boots on today, had my boots on Saturday night, felt so good. I went out country dancing. Haven't done that with my girlfriends in a long time. And then she said, I even got dipped twice. And then she's bending
Awesome.
backwards the whole time, going, look, look, no pain. And we, I did an examination on her, and I couldn't recreate any pain for her. And it was basically the end. I heard from her once after that, probably about 6 months later, just a thank you letter to the clinic. And that was her story. So if you
Wow.
tell me that things don't lay latent in the body, I have too many stories like this, right?
What a
Like,
beautiful, succinct testament to it, because it is like, you know, with everything, you could talk a lot or you could do a lot of, physical work, but at some point it's all in the same system. Sometimes it needs to relate, and how it came out. She did a lot of talking, she did a lot of work, and then she just needed that extra connection to
yeah.
happen to then put it all together and then really let it go and release it, like in a, not just like a just let it go sort of flippant thing, but really she was able to integrate and release. How, what amazing work. And you say you see that all the time? It happens
Well,
over, or a
it's not
lot of the time,
necessarily all the time, but it
but maybe not that like significantly like dramatic
no.
as like, but I'm sure
There
there's
have been those
there.
along the way, but
Yeah.
for the most part, people can connect to their pain. Most people will emote without making a connection to an event. It's just
Mm-hmm.
stuff that we've held on to. It's just baggage, and just feeling like they have a safe place to allow that to happen. Most people are like, "Oh my God, I don't know why I'm crying," and I'm like, and that's okay. And it's just, you know, your emotions are coming up for whatever reason. You don't have to put a label on it. Just allow them to come up, and and that's fine. I do a lot of structural work, which can lead to the emotional work. You know, I had one teacher who put a lot of emphasis on the unwind. Um,
Mhm.
and unwinding a body can bring up a lot of trauma, but it's not necessarily, I don't know, it may not be a safe space, because I don't know that a lot of therapists are really truly trauma informed enough to do that work with people. So, yeah, so there's a caveat to that, right? And I just say when the body is ready, and like the mind's never ready for this. Right? And like, well, I'm embarrassed. I don't want to do this right now. Yeah, and if you trust me, let's just hang out with this and see where this goes. And they always feel so much like lighter after we're done a
Mhm.
session, right? Like they've let go of things, and so yeah, there's it's like the right time to have kids. There is no right time to have kids, and
Right,
there
it
isn't.
probably comes up
When they come and they
whenever it
come.
comes up. Yeah,
That's right, right.
exactly.
Life has a way. And as much as your brain is trying to say, oh, your thoughts are trying to control things all the time, your emotions and your feelings need to be expressed as well, right? For health. So if they come out without the brain understanding why, it's okay. It's just,
Maybe
well,
something
I will
better.
hold your hand through it, and because I've been through it myself, right? And yeah, it's a much better pathway to walk.
Now, do you, you mentioned a lot of therapists aren't trauma informed, and I feel the same way. But I'm not a forcer anywhere in my therapy either. Like, you can't, like, when you go like to a session or a day and like force it away or breathing, I kind
Mm.
of stay away from that stuff because I feel like the body protected you for a reason and it needs to have a more gentle approach in order to actually release it. Sometimes you can just create, in my view, more boundaries around the thing by putting it back in because you don't really feel, you didn't process it in the first place. There's probably a good reason
Hmm.
why. So
Hmm.
why, if now I'm going to force my body to do it, it's probably not what it is needed. So I really like that you look at that, there's and say that out loud that just because you're going to maybe go do myofascial release somewhere and you might be looking for a therapist who's ever listening like you that would take the whole body and really be informed about it. There's different levels of education and views about how informed you are. And this is all to say, when you teach other professionals this, do you include the trauma informed part in your courses, or where does that kind of lead in the training of a professional that is doing the work that you are beautifully doing and bringing out to everyone? Because everyone, no matter if you don't think so, no one goes through childhood unscathed. Everyone has stuff. Life brings stuff with us, right? So it's not bad. It's not like your life was bad or anything, or good if you have it. It's like we process stuff and sometimes we don't. And that's the stuff I think that you kind of really can get into in a physical way. So,
Well, and it's interesting you say that, from a childhood, like if I'm doing like say I'm doing a neck unwinding with somebody where they're sitting up on my table, and I'm doing this gentle process of unwinding the neck. Um, there'll be glitches in the movement, right? So people will be moving along, all of a sudden it just gets stuck and it wants to get out of that. Like a little glitch where the nervous system is just skipping over an area. And, traditionally that's been called the still point after Andrew Still, the creator of osteopathy, and his beautiful work. Uh, so that still point, you want to bring somebody back to it, but it's a glitch, and people will be like, "Well, why do I have so many glitches in my neck? I must be broken or something." And I'm like, "No, man, you pick this up all the time. If your head was turned in a certain direction, you heard something you didn't like, your nervous system would record that as, oh, I don't like that particular degree of movement because it reminds me of this. Let's skip over that. You could have been crawling in the kitchen with your head moving back and forth, and your mom dropped a pan on a pan on the floor, and it went bang, and you went in this position. I mean, it's just we come by this, stuckness, this tension that develops over time pretty naturally in the nervous system. Some of us are a little bit more like I was. I would say that I was a very sensitive kid, and I think most people who get into my profession are very empathetic people, and are on the sensitive scale pretty high, and probably your profession as well, right? We tune into things differently, um, and uh, and I think that makes for a really good therapist, to be able to understand that some people will have these traumas that they incur, and just brush it off like it's nothing. But we could hear that little story if they want to tell it and go, well, I think that has more significance than you think it does, right? So, and just
mhm.
adding everything up, it's basically, like the body keeps the score. That wonderful book. It's uh, it's an accumulative process of trauma over time, mental, emotional, and physical. And there are ways to access, your well-being depends on all of those aspects.
Mhm.
So we have to look at
That's
them all, and I am not skilled in all of those things, and I will refer out if I need to. That's absolute. I am not the be all and end all of anybody's healthcare. I tell people that, right? Like I am a link in the chain, and if you come and see me for an assessment, and I flag you that you need to see somebody else first before you see me, or maybe I'm not even involved, I will go to great lengths to make sure that you can get that appointment and that done because, yeah, it's not me.
that's a beautiful awareness as you as a practitioner too. Like you know what you do and you know how to help people in different ways. You have resources because that's also just as helpful as to go to someone and get resource. At least when they talk to you, they get a resource something. It's not just like I can't help you or I'm gonna, it's
Mm,
really a resource because I know a lot of people and I don't know if we talked about it before or whatever, but medical trauma is a real thing down here with all
mm,
of like, especially with lipedema I have all these invisible illnesses. Like I've been in chronic pain since I was 7. I had migraines. I have hypermobility EDS, which is, a whole topic in and of itself, whether,
mhm,
it exists or not, or how. So MCAS, which is now a little bit more understood, but a lot of dysautonomia comes from that as well, but also the POTS and the MCAS, and the hypermobility and I have chronic fatigue syndrome and I have lipedema. So I have all these things that
mm,
for years affected my gut and my health and my pain level.
mhm, mhm,
So it took me quite a few doctors, literally 10 functional doctors that missed it. And then I finally found someone that diagnosed one thing that led to some other things. But I'm not the only woman that goes in and they're like, oh my gosh, I'm in so much pain. I have all this bloating. I have all these things. And most of the time it's assessed as, oh, it's probably hormonal. It's probably stress. Don't worry about it. Women usually get more like they're just like being over dramatic about the pain,
yeah.
which is interesting is like most of the women in my situation, we actually underdo our pain. We're in so much pain and we underscore it. Because 10 is supposed to go to the hospital, but I've gone to the hospital before and they can't really do anything. So really you function at a 7 to 10 and then really a higher. And because people can't see pain, like I
Mhm,
don't look like I'm in pain, but I am. It's not
mhm.
something like, if I broke my arm, you'd be like, oh, she broke her arm. Or if I had a deformity, oh, she has this deformity. But in this invisible illness of world, do you see a lot of women that either have these chronic conditions that have been undiagnosed or have any sort of medical trauma.
Oh my
And they
gosh, yeah,
come, okay,
on a regular basis.
okay.
Yeah, well, three-quarters of the people I've treated over the years, I would say, are women.
Mhm.
And um, yeah, more women than men seem to seek treatment. And the I would say, well, I was telling you, I think earlier, my friend Erica and I were, who's the pelvic health specialist.
Mhm.
We've had this discussion more than once, and we just shake our heads because I've had women come to me, and I'm talking with them about their situations, and I'll say, what has your doctor told you about your incontinence, or what has your doctor told you about, any of the pelvic floor dysfunction, painful sex, all of that stuff. And, is your doctor concerned about your relationship right now with your husband who is not understanding anything because you don't get any information from your doctor to talk about what's happening to you? And she goes, well, no, they usually just like she usually just said, "You had a baby. What do you expect?" And it's like,
Mhm.
what?
Yeah.
And when Erica and I get into this discussion, I mean, it's more of a rant, to be honest with you, just getting stuff out
Right.
because as medical, or I should say, as healthcare professions, we need to talk about it because we see so many things that are just glossed over, and women's health directly. Women's health directly. I can attest to the fact that it's a man's world in a lot of ways, and it certainly still is in the healthcare field, where a lot of the women that I've had and sent back to their doctors, and I've even talked to doctors on the phone, and said, if we can have a conversation, that'd be great because I need to talk. And then when I can have a conversation, they'll say, "Oh, well, I wasn't sure," and given her background and blah, blah, whatever you want to say, as long as you are ready to get behind this and let's get some tests done, let's get some referrals, and let's move the ball for this one, because yeah, it's a pandemic of its own.
It really is. And I love that you're able to get on in there and on the phone, because there is something with, if you bring in some sort of evidence or something else, like just what you're saying, like her background, or I just thought, or, they really kind of brush a lot of the symptoms off, because the symptoms can be kind of weird. How do you really talk
Mm,
about your level of brain fog? And how do you really talk about your level of pain when, I mean, you're in the pain world, but I have a very high pain tolerance compared to someone else. And still, that
mhm,
is subjective. Or if,
mhm,
I wake up with like, aching legs or back, there's things that they're like, oh, well, that could be kind of anything. There's these weird sort
mm,
of, oh, you're tired. Well, no, fatigue, like I can't function. But they don't really understand, like, and even a lot of people, they don't understand unless you kind of go through it, or maybe you've been through it, or you see a lot of people with it. It's hard to really kind of understand, like, yeah, fatigue, it's not like, oh, I could take a nap and I feel better. It's like I
mhm,
really can't function, and how to help with that. So I'm just really grateful that you're an advocate and able to get on the phone with providers to help your patients, or whoever needs to be in their system, to give them the test or what they need, and also make it validating, because it does suck when you're out there and you like see all these people, and then like they're like, oh, nothing's wrong with you, and you're like, well, I don't feel normal, but maybe it is me. Maybe I am making this up. Maybe I am having some sort of body dysmorphia, or maybe. So there's I think a lot of, like, that, to use the newfangled term gaslighting in that, because like
mhm,
once you go and they say, no, well, your blood work looks great. You're really just, what you're saying and what I'm seeing don't correlate. So you must
mm,
be making it up because the tests say that you are.
mm,
So that is like, I'm just really expressing my gratitude. And I think any of my listeners out there also, that you actually recognize that it is something that there are interventions. And once you understand them, there's a lot of different things you can do in your life. Get this myofascial release. If you have hypermobility, you change your range of motion, you do different electrolytes. If you have POT, like there's things out there that can support you so you're not in so many flares. So that's just
yeah.
my gratitude to you.
Oh, well, thank you. And I'm just trying to spread information, and send people to as many informed people in their areas of expertise as I can. With chronic fatigue, we used to treat that a lot, at the chronic pain clinic. But after doing brain map, can try to figure out where and why it's happening inside the brain, and do the neural feedback to reset the brain. So that eases off the chronic fatigue, which helps tremendously for you to be able to heal in other areas, because um, your nervous system is willing to accept, your brain's willing to accept new information, where a lot of times the brain gets stuck, especially we see this with concussion, or any of the traumatic, mild traumatic brain injuries, where yeah, the brain's just shutting off. It's like traditional therapies. If I did traditional massage or whatnot, I know I'll speak to massage specifically, but if somebody's very chronic, and you're doing that good work on them, what to do to just to ease the tension, well, that will ease the tension in the muscles for a short period of time. I mean, reflexly, it goes to the um, um, spinal cord, and then the message gets sent back to relax. But when it goes to the upper motor to say, hey, let's store this, it's going, nope, I'm full. I've got so much chronic pain signal. I am not even remotely interested in accepting anything else you're sending from below the neck. Right. So forget it.
Mhm.
So in cases like that, the myofascial release can help, but it's being able to tweak the brain, that neural feedback that there's a lot of wonderful practitioners from what I understand in the United States, and there's a few in Canada, but the guru of all this was really Dr. Mary Lee Esty, and now she's moved to Denver, but she was in Washington. Um, and the work she's done is incredible. And but there is help, like you just got to dig for it. And I think doctors are overwhelmed on a regular basis. Our healthcare system is taxed all the time, and I think you get into a I just want to get through my day kind of thing.
Mhm.
So, and like,
And if
yeah,
there's not that much research, like, for us, it's IC9 or ICD-10 codes or whatever. So if there's not a code for it, or if there's not like something like, oh, she checks these, yeah, you want like maybe see a provider, your PCP, like 15 minutes. So if there's not something like they're used to kind of diagnosing, it is a little bit more challenging to kind of
absolutely.
get them to turn around.
I don't want to put any blame on the doctors.
Yeah.
Every one of them is individual, and they
Hmm.
come at it from the direction they come. And I'm grateful to work with the medical community on a lot of
We have
things.
to. Yeah.
However, um, you know, some people have been just kind of their symptoms have kind of been just shoo-shooed away, and it's kind of like, I'd rather we dig a little deeper into this and see what we can come up with, if there's something better. Because some doctors are open to suggestion, so
Yeah.
which is great. So people used to come into our chronic pain clinic, this is 25, 30 years ago, but they'd be on 15 medications. And after doing assessment, we'd say, can we get them off like maybe half these? And usually they were very receptive to that. And they'd say, yeah, let's take a look at that. You know, now I have to try to get people to go on medication because they're so anti-medication. I'm like, painkillers are for the short term, and stop taxing your nervous system trying to handle your pain. And if you're not sleeping and melatonin doesn't work or CBD doesn't work, you're going to have to take something to shut your body down so it can do the repair work it needs to do. It's just, but again, I find that my approach is about educating the patient
Mhm.
from my perspective of where they're at, and trying to give them. I think that they do well with me because they have an understanding as to what's happened to them and where we're moving.
And I love that it's an education as well, so they can take it to like just like podcasting, getting the word out about this approach and how it is part of the whole is that there is an option. So some like me that has different chronic pain from different ways, or if you have chronic pain because you had failed back surgery 10 years ago, or if you just, for whatever reason, you could have other things, that this is a nice technique that really kind of helps heal your system in a different way, which is sounds more gentle and um, helps you release things that maybe are stored there that are preventing those more healthy pathways or neurotrans or however you want to say it, but basically helps your body function more optimally
Yeah.
is
Oh,
the
no,
easier way
absolutely. Well,
to say
and
it.
that's, yeah, I enjoy what I do. I mean, I'm
Yeah.
passionate about it, and I've been an educator for a long period of time too. So I really have a lot of passion. I mean, there's only so much passion you can have for anatomy and physiology before it gets a little old, but I'm not that person. but uh but being able to teach people how to do this, and then getting the testimonials back from therapists who have taken the courses saying, I had somebody who was stuck for so long and I applied that technique and they've never felt, in one session. And I'm like, okay. And I also want to caveat that with, and keep looking at everything that you need to that has to have an effect globally on their body, and make sure that you keep applying the techniques, because it's going to take a while before they get more permanent change in the brain to make a shift and no longer be in that stuck position. So
Is
uh,
everyone a little bit different as far as timing once you kind of get into opening up a pathway that has been stuck for a while? Does it
completely.
like it could take that one time, or it could take,
That's the
X
question I
amount of
get asked
times.
all the time,
Like that, it's just
right?
really because well, yeah. And I find like all of this is very individual. Like
Yeah, very
what
much.
works for me and doesn't work for someone else. But there's like
Yeah.
little, but it's kind of how you have to piece it together of what works and have expectations of, like you said, that incremental change. So incremental for me might be 6 weeks, it might be a year, and someone else it might be like 2 sessions. We all are at different sort of levels, and going into approaching our healthcare and resources and tools to help us, our expectations need to be like, I think we all have been marketed to like there's a magic pill, like this new thing. Like
Mm,
I don't know if it's the same, but in the United States there's always like what new superfood, what new thing.
mm,
You take this one thing, you have like, this berry every day, and you lose, 50 pounds and look 20 years younger, right?
hmm
Which doesn't always work, but I think, we kind of are
hmm
in this world of like, we kind of want this magic. I know certain times I felt like, oh gosh, if this one thing, if I can find the one thing that is making everything all messed up, uh, I would be happy. But I've learned that it's not just one thing. It's like, so there's fat, and it's layers too. So there's
hmm
fascia, there's my emotions, there's my view on things, there's genetics, there's this, there's that, there's the other. So it's really just like you going into this knowing that, like, okay, there's a way out and less pain, but the process is going to look so different for each of us. I think is important to kind of put expectations. And it sounds like that's what you do with your holistic approach, because if there's certain times where you need to refer out, and they stop seeing you or they continue, you have that available to someone.
Absolutely, 100%. That everybody is so vastly different. You know, here's a little thing that I remember from my time at the chronic pain clinic, but Dr. Donaldson kept the, statistics and everything. He was a true psychologist. So anyway, one of the stats that he kept was on people who had support or didn't have support. So when comparing numbers, that if you came in with very similar symptoms to somebody else and the markers are all very similar on your testing, how long it took you to move through our program to get to the point where you were like an 8 out of 10. That's what we considered kind of the success mark. That's what we would shoot for shift and change. Those with support went through the program 3 times faster than those who didn't. So if that's another question that I like to ask people is, do you have support in your life? Is there somebody helping you? Do you have somebody you can rely on to talk to? Um, and you'd be amazed at how many people don't. And I can then go back and say, okay, so I'm going to help this person. I'm going to find a gentle place for this person to fall, because I need to be able to say this road may take a little bit longer than not. And what supports are you looking for? What would you like in your life that you don't have now? Um, because most people are just so stuck in being in pain, they don't see the rest of their needs, that they just slogging through the day, and it's tough. So, that's just one element that can separate one person from another and how well they do in treatment.
That's so true. And just, it's, and again, having a provider, you or whoever, like people that you teach or your clinics,
Mm,
have that listening aspect, because that's supportive too. Just seriously, when I got my diagnosis of lipedema, like I cried. One, because it was like, oh God, I thought I wanted the other one that was easier to cure, but I
mm,
got this one. But at least it was so a relief when someone told me like, oh my God, all these symptoms, oh, it's X, Y, and Z, because she's been doing it for 20 years, but everyone else I didn't. So there is that like kind of thing where you're like, oh, that's support right there. Just by getting, just not being dismissed is really supportive. I think
mhm.
just right there. So and not having support on the other end. But if someone's not listening to you and you don't really know how to, and you can't even tell your spouse or your friends around you, they don't really understand when someone does. I think it's a huge shift just in like, okay, at least I know I'm not making this up. Someone hears me, and there is a path in which I can kind of lean on this person and go there and maybe see what we could do together
Well,
to get this going.
you bring up a great point because there's a lot of people who are in your situation and similar situations where, it's hard for the spouse to understand. I was visiting friends of mine, and my buddy has a serious back issue, 3 surgeries already. But one day I just said to his wife, and I said, "How are you with all this?" And she said, "Mm, well, good." And I went, "Yeah, but seriously, well, kind of sucks because, he's in pain all the time and it's hard to. I said, it was a massive shift in his life and it was a massive shift in your life. And you got to look at it like that. And you don't have to put on the brave face all the time. It's okay to be you and say, this does suck because it sucks for you too. And that doesn't mean that, there's an abandonment thing happening there. It's just acknowledge it, right? Acknowledge what you're going through. And spouses of people who have a chronic situation need to hear that. Need to hear that it's okay. I recognize you. You're I see you too. This can't be easy, right? You're taking over more of the work load with the kids, with the cooking, the cleaning, and the blah blah blah. And your spouse is probably sitting there going, feeling guilty about it, and you're feeling resentful about it, and you should probably talk about it.
Yeah.
You
I
know what
mean,
I mean?
really, the spouses and chronic, they should get the same sort of uh, release because, especially with fascia during stress, because it is. My husband, is great, but I know it impacts us, and it's not that fun to have like a sick wife. So, and there is a grief on both of us because it's not like how that change happened. So, and also honoring, you talked at the beginning about depression that you had that you didn't know. There is a grief, and to honor grief and to a change, whether it's positive or negative, a change, really kind of honoring that change and talking about it more and having places where you can be like, yeah, I'm not going to leave you and the world's not over, but there is a shift. So let's grieve what was so we can kind of really embrace this new
Hmm.
path because it's not just going to be like, oh, this is fine. Like you can't do anything anymore. Intimate relationships change. You talked about pelvic work that you're doing with Erica, and all that, especially women with chronic pain, depending on what there does impact your life on all levels.
All
So
levels.
so it really does need to be addressed. So a couple more things, but I really love this conversation. Is there anyone that's listening out there? What would you say if they don't have resources or can't get to myofascial release specialists in their area? I'm gonna put all your links below, and I'm sure you can. If you're very open, so I'm gonna say I want them to reach out to you and look through your website and all this
Sure.
and find your courses. But is there anything you can do self myofascial release? Is that a thing? Or what would you recommend to someone if they have like a pain in their back? Or is it better to go see a professional?
Okay, so for those who can't get out or don't have the resources at this point to be able to move physically or monetarily to get to somebody to help them, um, yeah, that's a good idea. I was thinking about creating a small online YouTube kind of situation where I can show people various elements of fascial stretching and how that can assist them. Um, now these are, my list is pretty long. I can't stop creating. I have this brain where I'm like, I'm creating new courses all the time because I'm like, oh, and this and this, and people need to know this, you know.
Yep.
But yeah, absolutely. And they can contact me. Just
Okay.
bear with me as I'm very ADHD, so I'm not always the most. Um, I'll get back to you. it's just hard to do it in this
I
timely
gave you
event.
another thing to do because that is, especially with women with lipedema that are more, so mobility, so lipedema is a fat disorder that you have diseased fat. It doesn't behave naturally and it's disproportionate. Like different parts of your body will accumulate fat and bulk. The only thing there is for it now is to remove the diseased fat through liposuction. There is
Hmm.
conservative measures, but what it does, other than the pain, it also affects your mobility. So as you progress, some people don't, some people do. That's all a mystery. Who knows? But part of it is that a lot of times people get chair bound. So that's also stiffness in neck and things. So
Hmm.
I'm just
Hmm.
giving you some information if you ever want to, for your videos that you're going to make eventually on the long list of things to create, but something to help with mobility when you have a disproportionate amount of weight in your lower body, and your legs are just not just heavy because they're large, but it's dense fibrotic tissue. The fat becomes
Hmm.
dense because the cycle is, the foreign object goes there, it's too big, the lymph can't pull it out, so fibrosis material goes, all the more sciencey part, so it goes to help out, and that's their bigger molecules, and then they don't leave. And for whatever genetics happen, that it's usually a genetic condition, they think,
Hmm.
and it's somehow estrogen is a factor. In some people it's too much, some people it's too low, but it's usually puberty, pregnancy, and menopause is where
Mm.
you might have more fibros, more fat accumulate in these areas and grow. But mobility is a big thing. A lot of people that if you don't get treated, you can't really walk because how the fibrotic material impacts your joints and the range, but also all these other symptoms that are. But if you're sitting a lot, pelvic cooling, all of that stuff. So I think I want to segue in, and that was one of the last questions, is
Mhm.
like, is this pelvic workshop that you're going to create or creating, is that for public or is it just patient facing or is it really just professional facing?
Um, it's going to be for the public.
Okay.
We want women to be from wherever to be able to access it, and I think we'll make part of it online. But we'd love to do a weekend in Nova Scotia
Mm-hmm.
for those who can afford to come. Beautiful area of the world, and uh, and we will be creating some online courses for therapists. The only thing I can do is, like I said, I'm going to put online material up this winter for therapists,
Yeah.
but
Okay.
it's the touch that I'd like people to come to the workshop to figure out how to be able to hear the body and what it's telling you to do and how to move it. Um, and what you said about the liposuction too, creates some scarring situation in the body too. So the myofascial would be very indicated for that. And sedentary is the enemy of the body, right? It's how fascia becomes viscous, and then you create this fascial um, tension or stiffening or so I'm trying to come up with the right frame of reference there for that. That's not coming to me right now.
That's
Happens
okay.
uh,
Yep.
on a regular. But
I get it.
but
I get that.
the fascia needs to glide on itself,
Uh-huh.
and but with movement, it becomes quite stiff and stuck, and then without
Right.
movement. So again, yeah, sedentary is the enemy of the
Mhm.
of the body's ability to function properly. We need to move. We're built to move. So if you have something that is creating a situation where you're having a hard time moving, then getting somebody to passively move you even would be a great thing to do. But
Mhm.
if you can move whatever you can, maybe there's ways we figure out how to affect, stretch, or pull in certain areas of the body that you weren't able to get before. But yeah, yeah,
That's great.
it's vital.
Yeah. Well, I can't wait to see those videos whenever, no pressure. Whenever you're ready, just another list. I know you have a lot of, you do a lot of trainings and they can find all of your courses right when you're online, like through your website. Is that correct?
Yes. Yep.
Okay. And I'll leave all those links below. And then another question, just do you have anything like any advice or something that you wish you had maybe known earlier along your journey? Or do you tell clients, is there anything like any wisdom that you would like to impart of anyone when they're going through chronic pain, like go see a myofascial therapist sooner than later, or or anything like that? That was just a joke. But is there anything in your 30 years that just like, hey, if you could tell all these patients like years before they come into your door, what would the advice you would give them to know or to do?
Get on it as soon as you can. Once you recognize that you've changed, if there's a shift in pattern or your inability to do activities that you normally did, et cetera, get on it. Most of the time, I see people in their, you know, late 40s through their 50s, early 60s, and we're already behind the eight ball. We got a lot of work to do. So the sooner you get on your situation, the more likely you won't have to incur more because trauma is accumulative. And if you're dealing with stuff now and going, well, I can deal with it, and let me caveat that because most of the time, like when I'm teaching therapists, I will talk about chronic pain a little bit here and there, but I'll also say, most of your patients probably have a chronic issue. Maybe they don't think of themselves as falling into the chronic pain situation, but it's like somebody comes in with a neck situation with me, and I'm saying, okay, well, let's do your physical assessment now. I'll do the standing posture and lying down and any orthopedic tests I need to do, etc. And they reach down to start undoing their shoes and they grunt, right? Like, oh, and like, okay, well, tell me about that. What's going on there? And do you have a low back issue? Because you didn't mention that. And they're like, oh, well, yeah, it's just, and up in Canada, this is more typical of this scenario. But, oh, yeah, I was playing hockey with the boys and I got slammed into slid hard into the boards, lost my footing, and it's just never quite been the same. But, did you get something done about that? No. And how old is that injury? Oh, well, I don't know, 10, 12 years now. I'm like, okay. So you're setting up yourself for patterns
Mm.
of tension, furthering the patterns that you already have because you sit at a desk all day or et cetera, et cetera. And you're slowly becoming shrink wrapped. And maybe there's a reason your neck is now in pain because there are a lot of people who come to me with insidious neck pain. They're just like, well, I woke up and it was sore, and then it's been 3 years now, and it's super sore. And I've seen physio, I've seen doctors, I've seen chiro and massage, and then when I look at the body and I see that their pelvis is like way out of whack, and I'm like, did you have a back injury or something? Oh, not that I remember. Or it doesn't really matter. If you're imbalanced like this, everything above is going to be affected. And eventually you'll start to feel pain much further distal from the area of where the real problem is. So
That
it's
is interesting. Yeah, that you just like something you don't think that you would go get some treatment for may be the catalyst to have these pathways where you might then radiate pain in your neck later, right?
100%,
So, to
100%.
I love that. So like don't kind of brush it off. Like go and get these things looked at
Yeah,
from a professional. And I do like that you said that for that I do believe we're all like humans. There has to be a relationship that we're all in relationship. We have to be in relationship with other and having someone that touch to kind of help move you through, whether you talk about trauma, whether anything comes up, but definitely being in relationship with other actually is a healing aspect. I know when I went through my therapy program, they're like, what's the most effective psychotherapy there is? Freud, CBT, whatever. And always the answer is that doesn't really matter. It's the relationship between the therapist and the patient, and the
Mm,
transference and countertransference. That is the magic, is
hmm
that it's not really the technique always. So with your technique, it's to actually have someone that knows how to do that. And then it's the relationship where that, the magic of the healing happens through that. It's
hmm
them coming and the person. So there is you know, I do like to say and offer like self things because some people can't get out or they don't have it, and but
hmm
maybe with this, both happen so well, especially since you're dealing with trauma in the body, and trauma could be like, you hurt yourself and you like your hockey example.
hmm
So does he really think that that's trauma? No, but the body does like, hey, I got rammed up into this thing. Now I need
Yeah.
to protect myself and I need to move differently because I don't want to have that feeling again. So
hmm
having this personal person connection, I think, is very important, especially after the pandemic and being separated. And that's just
Yeah.
my personal view. But after everything you've told me, it's like to have someone like be with you, and then also how you can communicate in that personal way is like, sounds like highly effective, and there's tons of research and science behind it because we are a research science culture, but
Yeah.
also there's that je ne sais quoi of like, why going to Peter, like, it really helps me more than maybe, Sam. It's a different also kind of gestalt of what you offer, which
Mhm.
is beautiful. I
Well,
like it.
to me, it when you can work with somebody, when you as a therapist, when someone comes in to see you and you can identify with them, that's huge. That gains their trust. Um, you know, More often than not, people will say, "How come no one's ever asked me these questions?" And that is simply because they just didn't know to ask the questions. And I do, and I'll ask questions that will tweak so many different elements to their situation. And that's what I need to do. I just need to unravel as much of it as I can in order to sort it out for you. And so then we can move forward. And then people start to have hope because they're educated and they know what's happening to them and they're not being brushed off. And just even the simplicity of being, that um, inviting as a therapist. But
Mhm.
if I could say anything, it's funny you brought up the pandemic, but numbers, in-class numbers, tend to be uh, a little lower since the pandemic. This new generation coming up of therapists tend to like to have everything on the screen, and I'm hoping I can shift that idea because I can't teach you this from a screen, you
Yeah.
know, to be effective. So
Well,
yeah.
I love it. So how do you like people to contact you more? Do you like email? Are you on any platforms that you like people to reach out to you, or how
Mm.
do you like to have
Uh,
just inquiries?
yeah, no, people can reach me through my website or
Okay.
on Facebook or on LinkedIn. Um, uh, I'm newer to LinkedIn. I must be honest, when I first got into LinkedIn years ago, I did not like the energy of LinkedIn. I just thought it was incredibly dry and boring. And I was like, what am I doing here? People would, say, oh, so and so is, 3 years at the same job. And I'm like, ugh, I don't care. I don't. And not because I don't, it's just my time
That's
is
not
so precious to
it.
me. It's
Yeah.
just yeah, I don't want to have to sift through all of this stuff to get to somebody has a message for you, that is relevant. So please, you can go to LinkedIn and give me relevant messages. I'd love that. So yeah, so that's how people can reach me if they want to reach out, and I'd love to be able to talk to therapists and have that conversation, be able to have more people doing this work because I
Yeah.
think it's really great from an approach of that trauma informed.
Yeah. And I think especially in, you know, I think dysautonomia in general, I want to say that 70 million people have it. So
Mm,
dysautonomia, And this seems like it's very linked. So a lot of people are having things. I mean, even if you don't have stuff, like to go and to see you would be amazing because our bodies have something, right?
Right?
It doesn't, it doesn't have to be, and hopefully, and I do want, I mean, that's the whole reason why I have these conversations and I want to talk about it. Because if I would have known, and I was in the fitness industry and therapy, whatever, and I've missed all of my things. If I would have had
Mm,
some different knowledge about like really what the condition was when I was in my 20s, I probably wouldn't be in the state that I am with all the chronic pain and
right.
earlier interventions. And like they don't have to be scary, it doesn't have to be hard. And I really am also pushing to this, pushing through isn't always the best, especially if you're susceptible to dysautonomia or chronic illnesses. That's usually the antithesis. And that's been a hard one for me to do, is to rest and to not push and to not like, how can I attack this problem head on? No, I
Mm,
have to go get something very nice and gentle. And it has to feel like not much because my body is so already in such a heightened state of wanting to defend itself. I need to kind of learn how to be in my rest and digest, which I'm not
hmm.
on a
Right?
cellular level, right?
Yeah.
So, and younger practitioners, I do think the in-person connection is so important. So I am all about to getting back into person and doing things and really feeling like what this body feels like. It's different than theoretically, because like my idea of what it feels like maybe isn't really what it feels like. So having that sort of in real time interaction, I think is so important.
Well, I always tell real therapists. I always tell younger therapists, right? People who are newer in the field, just if you want to get good at therapy, get therapy, right?
Mm-hmm.
Know what touches you like, what you don't like, and you will have a sixth sense as to how you're touching somebody else. So it's really important to get the work done.
Beautiful. Well, thank you so much for all of your time and sharing all your knowledge and having this conversation with me. So, I'm going to put Peter's links down below. And if you have a therapist that you think would be well, tell your therapist, like your MLD therapist, your OTs, anyone out there listening to have any sort of therapist, massage therapist about this technique, about Peter. They could go to his website and take one of his courses. And I'll be looking for and probably resharing your pelvic course because I think that is such an amazing thing for patients, for women to know. I think a lot of probably my issues can started to be corrected when I worked with my pelvis, and I can't wait to take your course. And Nova Scotia, if you have it in person up there, I heard it's beautiful. I'd love to go. So, and just in the final thing, is there anything that I miss? Anything you just want people to know, or any final words? You don't have to, but if I want to leave that open, if there's anything.
Yeah, just go get treated before it becomes a situation. See your physio, your chiro, your massage, your osteo, whoever it is. Go get treatment. Don't hang on to stuff.
Oh, that's beautiful. Well, again,
Or your psychotherapist,
yes.
psychologist, counselor. Don't hang on to stuff.
Yeah. And I think you need both,
Oh,
100%.
absolutely.
Like
Absolutely.
we're limited on both ends. So it's a beautiful Venn diagram of
Yes.
body and, because there's that beautiful sweet spot. So Peter, again, thank you so much. And thank you everyone for listening. And I will see you next week.
All right. Thanks very much.